Hey, welcome. Dr. Collins here, Clinic Director of Invista Medical, and I'm going to go through your pre-report of findings class. You may have already had your report of findings by now, but it's important as we start you under a care plan that we have a clear understanding of the roadmap to get you out of pain and get you the best health potential possible. Our goal is to help you achieve your health goals, and watching this class is an important part of it. So thank you for your time, and we're going to go through this pretty quickly, but we'll have time to talk afterwards if you have any questions or concerns. So our purpose is to help you get and stay out of pain, to help you regain and protect your health, to provide the safest and most effective treatment options available today, and to educate our community on the importance of restoring health and body balance rather than depending on dangerous drugs or risking surgery. So in Vista Medical Neck and Back Center, we are an integrated physical and regenerative medicine office. We have many successful methods to treat acute and chronic pain conditions. We use a team approach that focuses on correcting the cause of the problem, and we've been successfully treating many pain and health conditions for decades here locally. We have helped thousands of patients just like you live a higher quality of life without drugs and surgery. And many of our patients tell us we're the best doctors they have seen, and they wish they had found us years ago. We're committed to help you achieve your health goals. So we believe there's an innate healing ability. We call this innate intelligence, that when our body is injured, when we get a cut, it's not the Band-Aid that heals us, it's our body. It's not the cast that heals us, it's an intelligence in our body. So we believe doctors are at their best when they help the patient unlock their own natural innate healing potential. And this healing potential works through the nerve system. The nerve system is what we call Houston control, the master system of the body. It controls all the other subsystems in our body. Everything that happens is a vast communication system between our brain, down through our spinal cord, and out to all the different organs, tissues, and cells in our body. So not just our sense of hearing, seeing, touching, smelling, tasting, everything we think, literally all things that happen, all life happens through the nerve system. So throughout life, we can create something called a subluxation. A subluxation is a term that means one or more of the spinal bones have misaligned, almost always due to stressful physical accidents like birth trauma, childhood falls, sporting injuries, car accidents, traumas to the spine. So we have 24 bones in the spine, 5 in green there in the lower back we call lumbar vertebrae, 12 in the mid back there in orange we call thoracic vertebrae, and 7 yellow there called cervical. The higher up the spine we go, the smaller the bones get and the more movable they get. And you can see on the bottom right there, that red nerve is a pinch nerve. When those nerves get pinched, they distort and disrupt the communication cycle going between the brain and the body. So this doesn't always give us pain, but it always creates an imbalance in the body, and always creates a lack of proper function and interferes with that innate healing potential. So these misalignments really are the core of what we do in the office, although we have a lot of supportive treatments, other things as well. So putting that together, our body is self-healing and regulating. I think all people would agree with this, all reasonable people. Fact number 2, the nervous system is the master controller, and that's out of Dorland's Medical Dictionary. So we have to conclude when you have subluxations, they interfere with our body's ability to heal and repair. And if this goes unchecked for years and decades, it leads to all types of disease processes, not just pain. So 2 main problems with subluxations. One, as you irritate nerves that go to muscles, they cause those muscles to contract. They'll pull the shoulder down, they pull the hip up, they twist. We'll see this on your x-ray evaluation. And they also interfere with the system, the overall communication. That's harder to test, and we're not always able to do that, but we do know, and it's been proven over the last 100 years scientifically, that subluxations always create an interference to that nerve system, and even a small amount of pressure can decrease your body's ability to communicate by up to 20 to 30%. So the chiropractic adjustment is almost always one of the core programs, unless we're doing a regenerative medicine on a specific joint like a knee or a shoulder. We're going to be wanting to adjust the spine to increase your body's ability to heal and repair. And this is going to have benefits of less pain, better range of motion, more energy, improved sleep, stronger immune system, so on and so forth. There's really 3 types of nerves: motor nerves, autonomic nerves, and pain or sensory nerves. The motor nerves are what control the muscles contracting and spasming. So when you put pressure on a motor nerve, that's what creates the body imbalance. When you put pressure on an autonomic nerve, that's what creates a dysfunction. with the body's ability to heal and operate correctly. And of course, if you put pressure on a sensory nerve, that gives you pain, burning, numbness, tingling, things like that. And what this pie graph shows you is that only about 10% of our body's nerve system is actually sensory nerves that give us pain. 90% controls function, and that's broken into motor and autonomic nerves. So waiting until our body gives us pain signals is not the best approach. What we like to do is check people before they have pain and correct those subluxations. However, many patients wait until they have pain, as pain is a great motivator. Most of you probably first presented to our office with a pain condition or a significant health problem. So chiropractic affects how efficient our body works. This is a study they did many, many decades ago, and it was a functional MRI. The one on the left is a cross-section of the brain. All those dots you can see there in red and white are areas of the brain that are sending an electrical impulse out. So what they did is they took some patients, and this is one particular patient in the study, and they did a functional MRI of the top of the brain, and they asked them just to do a simple movement of wiggling one of their feet. So this is all the areas of this particular patient's brain that had to fire to move one foot. So just a simple process. It took all those areas of the brain to function. They then took the patient out of the MRI machine, adjusted the upper neck back into alignment, freed up the pressure at the brainstem area, the upper cervical spine, and then they put the patient back in the MRI and said, hey, wiggle your ankle again. And then the one on the right there, the picture on the right, is about a 90% reduction in brain activity that it took to do the same function of wiggling the ankle. So what this told us is if you keep the upper neck in alignment, the brain becomes more efficient. If your brain becomes 70, 80, 90% more efficient, then your body's going to heal and repair much more efficiently. Many people have pain or health challenges or develop chronic illnesses and die prematurely simply because the brain gets so congested and backed up due to these upper cervical subluxations in the spine that the body can't heal and repair over years and decades, and that literally shortens our lifespan and decreases our quality of health significantly over time. So a couple research studies done years ago showed a 200% stronger immune system with patients getting adjusted regularly, and one was a 40% increase in CD4 cells on HIV patients that actually took them from being AIDS positive to AIDS negative by such a huge increase in the immune system. So that's something we've seen for years, is patients that get adjusted have side benefits, unlike drugs that have side effects that you don't like, some of them very serious or even life-threatening. Chiropractic patients tend to have more energy, they get sick less, they have better sleep, better digestion, less pain in other joints like their shoulders and knees and hips. They perform better in life, whether that's academically, athletically, or on the job or at home. Oftentimes allergy symptoms improve and emotional balances get better as well. So a part of your program is most likely going to include some physical therapy rehab programs. We're going to do some neck traction to help get the curve back in your neck. It's important to have a curve in our spine, and we're going to do some wobble board exercises to hydrate the discs in the lower back. We might do some cervical stretching to help get the range of motion back in the cervical spine as well. And then we have intersegmental traction and hydro massage therapies that can work on the mid and lower back. And usually this will be done before your adjustment. It takes about 15 to 30 minutes to complete. If you have any questions about any of these, you can talk to case manager or one of our PT staff in the office. Spinal decompression is usually recommended for patients that have significant lumbar or cervical problems or any type of radicular pain that travels down the arm or the leg. So when you pinch the lower cervical spine, you can create numbness, tingling, pain, loss of strength or sensation into the hand or hands. And in the lower back or the lumbar spine, this can create numbness, pain, or sciatica type pain. So if that's one of your presenting complaints, most likely we're going to recommend disc decompression or spinal decompression to help get the disc bulge off of that spinal nerve. This is the only FDA approved non-surgical fix for disc radicular conditions like sciatica or carpal tunnel. So that's compressed nerves in the lower back or the neck. We also use trigger point injections where we'll inject lidocaine or Serapin, a non-drug, into the area of muscle spasms. Trigger points are areas where muscles have become knotted up. They're painful when you palpate or poke on them, and they pull into the spine, and having these trigger points can accumulate over years and decades, make it really difficult for your spine to rebalance all the way back out. And sometimes these trigger points can be so severe, they'll actually yank your spine back in alignment. So this is covered by most PPO insurances, and our cash pricing on this is very affordable. Usually we're going to do 3, 4, or 5 per region. So a region would be cervical region, thoracic or mid-back region, lumbar or lower back region. So we'll do somewhere between 4 and 12 of these per treatment program, and then once we've done 3 or 4, we usually can knock those trigger points down 50, 60, 75% less, and that really is synergistic for your ability to heal. A lot of patients have the misunderstanding about trigger points. We're trying to numb or get rid of the pain, or if they don't have pain, they don't need these. If you have trigger points, they're very critical that we get rid of them. So even if you have an aversion to needles, we would ask that you would try a few of them. It's a very small needle. We go very superficial, inject a little bit of lidocaine, which shuts down the muscle, kind of like restarting your cell phone or computer. And most patients report, and I personally have had great success with these and think it's an important part of the program. So we also offer massage therapy. It's covered by some insurances, but for the most part, this is a cash add-on service. If it wasn't written into your treatment program, you can definitely ask about adding that on. We do half-hour and 1-hour massages, work out to be about 22 to 52 minutes of actual therapist time by the time we get you in and out of the room. You book the room for 30 or 60 minutes. And very important, if you book those, that you're on time for those appointments, because the room is booked just for that very specific time. We may prescribe some durable medical equipment. The 3 most common ones we do are a LSO, or lumbosacral orthotic brace, to help reshape the curve in the lower back, take stress off the lower back so that your body can heal and repair. You're going to wear this for about 1 to 2 hours a day during your initial 6 to 12 week treatment program, and then as needed, we're going to send some kind of device home, a traction unit, or more commonly a Denon roll, to get the curve back in your neck. And then if you have a knee issue, we have a knee unloading brace. We also have TENS units and scoliosis braces and other things, but these are the 3 most common braces. Many PPO insurances will cover the majority of these costs, if not all of it, for you. And then our cash discounted prices are very affordable. If you've been prescribed this, make sure you use them, and see our staff if you have any questions or concerns on how to best use them. So we have 3 stages of care. The first phase is what we call initial relief care. Our goal is to get you feeling better. We're typically going to recommend you come in 2 to 3 times per week or every day if you're in a lot of pain. And within 6 to 12 visits, we're able to get your pain down, in most cases, 50 to 75%, sometimes even 100%. This is where we're getting the body moving. We're working with the inflammatory process. Even if all of your pain is gone, which many of our patients report during the first phase of care, it doesn't mean we fixed your problems. It just means we've gotten the inflammation out of there, and we've got you moving forward enough to reduce or eliminate your pain. So typically we're going to recommend 2 to 3 times a week for 12 visits, and then do a reevaluation at 12 visits and decide on whether we need to continue with initial relief care, or if we can graduate you into phase 2, what we call corrective stabilization care. I like to call this phase of care the orthodontic stage of care, because like putting braces on, it's very important that you follow through and continue even after your spine is stabilized and your pain is gone, so that we can get long-term. Braces take 2 to 3 years typically to get your teeth to have muscle memory, ligament stability, so they can take off the braces and wear the retainer. For your spine, it's going to take us about 3 to 6 months of consistent care, although we can go down to from 3 times a week to twice a week to once a week, and sometimes even down to every other week during this phase of care. So many patients, if they're only coming in for pain relief, miss this stage of care and they terminate their care, which is a decision that you can make. But just know, if you do that, chances are we're not going to get the long-term stabilization. We're not going to fully correct the subluxations and the spinal imbalance, and eventually you're going to be back in the same, similar, or worse case than you were when we first met you. So this is actually an extremely important phase of care, and we'll be talking to you about that as we continue on. The third phase of care is what we call maintenance care. At some point, 2, 3, 4 months into care, we're going to have your spine stabilized. We'll have built in a new muscle memory, and then we recommend 1 to 2 visits a month on average. Usually every other week is the ideal for most people, and this should go on for the rest of your life, or as long as you want to maintain your health at the optimal level. So the road to recovery is intensive at first, seeing you 2 to 3 times a week for roughly 12 visits. Most of our patients can start slowing down their treatments. If you terminate care there on the right, you'll see you're going to go a period of time and then we'll have to start back all over, and eventually it gets harder and harder to fix you. If you'll go through with the corrective and the maintenance care, 1 or 2 visits a month to maintain optimal health for a lifetime is a small investment to pay. So these are some pictures of the curves in the neck. The left is normal. So if we were to look at the spine from the side, we should see an S-shaped curve with roughly a 30-degree curve in your cervical spine, 20-degree curve in your mid-back, and a 30-degree curve in your lumbar spine. When you lose the curves, it starts to put stress on those discs and really creates a lot of long-term problems. So the goal is to get your spine stabilized and save the disc. You can see the black in between each of those vertebrae is the disc. When those discs wear out, we call that disc degenerative disease. The longer you have imbalance in the spine, the worse that comes. And at some point, it becomes so bad that surgery may be your only option. We would definitely want to try to avoid that from happening. So take care of your body. It's the only one you have. They are designed to last 100 to 120 years. If they're not, it's because you're not properly taking care of them. So we want to get you straightened out as early as we can. We really don't want to wait until you're in a cane, a walker, or a wheelchair before we start to fix you. However, we've had many people that we've started here and able to get them back to living life without the assistance of one of those devices. So platelet-rich protein or plasma, PRP, is another tool that we use. This is more on the regenerative medicine side. We can take your blood, spin it down, throw away the red blood cells, keep the platelets in the plasma or the PRP, and re-inject that into areas of complaint. So this works exceptionally well for knees, shoulders, hips, but it also works well for the spine. We don't do it in our office currently, but you can use it to regrow hair or different types of sexual dysfunction like ED, urinary incontinence, other types of issues like that. So we don't typically add this into the first phase of care, but if you're not responding or you have a real serious problem or you have a joint problem, you can definitely make a special appointment to have this evaluation done and see if this is something we can add into your care. If you get to your 12th visit reeval and you're not happy with the progress we made, we haven't got the 50, 60, 100% improvement in symptoms, we're probably going to be recommending PRP as a continuing treatment to try to get you the results. And most of our patients that do the PRP with the physical medicine care plan typically get really, really good results. So here's a little video on PRP. We're not going to play in this presentation, but we can get that to you separately. So wellness is a lifestyle choice. So I like this quote from Paul Zane Pilzer's book back in 2002 called The Wellness Revolution. He says, the sickness business is reactive. Despite its enormous size, people become customers only when they are stricken by and react to a specific condition or complaint. The wellness business is proactive. People voluntarily become customers to feel healthier, to reduce the effects of aging, and to avoid becoming a customer of the sickness business. Everyone wants to become a customer of this early stage approach. So we rather raise healthy people than sick, sick adults. However, if you come to us in bad shape, we'll definitely get you out of the crisis, but choosing a wellness lifestyle. So if you'd like to do a wellness consult, we could talk about other things in chiropractic care that we can do for you to help you live a longer, healthier life. And then at some point you would probably want to refer, after you start to understand this, your spouse, your significant other, your children, your loved ones in, so that they can take care of problems before they become major problems. So if you have questions about that, please talk to one of our staff or case managers. So we want to plan to get healthier. Are you healthier today than you were 5 years from now? Chances are not, if you don't have a wellness plan in place and you haven't been getting adjusted and doing other chiropractic lifestyle choices. Our goal would be to have you healthier 5 years from now than you are today, and we can do that in almost every case that we take on because we're committed to providing exceptional healthcare and partner with you, not just to get out of pain, but to live a longer, higher quality of life. So thank you for your time. If you have any questions or concerns, please write them down and bring them up with one of your case managers or me in the office. We look forward to seeing you. God bless you. Best of luck to you. Thank you for taking the time to watch this video. This is Dr. Collins. Best of luck on your care program in our office.